welcome. I'm just going to run through the meeting objectives with you, what we're hoping to accomplish today. Can you go to the next slide? Yes, thanks. So today, in our time together, you'll learn a little bit about the Zoom platform. For those of you who haven't used it a lot, it seems like we already worked out a few kinks and are still working on that. So you'll be experts by the time we're done. We'll talk about what we're here to learn over the next 9 months together. And you'll learn a little bit more about the bigger project ECHO and how it came to be and sort of the bigger organization and approach. We'll look at the case template, which is something we'll use in every session except for this one. And it's a good thing for you all to be looking at that pretty closely and thinking about it, because we will be looking for sites to provide actual cases for us to look at. So that will be something to work with over time. We'll talk about the best practices for this platform and do a little evaluation at the end. So Jonathan is going to teach you about Zoom.
Hi, everybody. I'm Jonathan Church. I'm the business analyst here at Qualidyne and also the resident tech junkie guy. So I get to have the gift and the curse of knowing how to utilize all of these fun software and things we get to use. So you've all joined today. You're on the call, which is a great start. So there's a few ways that you can join to the ECHO sessions. So most of you that are on your computers or laptops probably use the Zoom link that may have been provided to you in your calendar Outlook or the emails that we send out, which we usually send out an email 2 days prior and a day prior to the session. So you can use that link to join from your computer or laptop. If you don't have that link, you can also just visit Zoom's website, which is www.zoom.us. And in the upper right, there is a link, or not a link, but a button that says join meeting. And as long as you have the meeting ID, which will not change throughout the entirety of our sessions, you can enter in that. Usually it's a 8 to 9 digit meeting ID. That'll also join you into the session. If you are not able to be on your computer or laptop, if you do have a smartphone, you can use the Zoom app, which you can download on either the iOS, your iPod, or your Android smartphone. Just to familiarize you a little bit with the layout that you look at when you join the session, this is kind of like the main splash screen of the Zoom software. And along the bottom, there's a bar, and that's really your navigation bar for anything that you need to do while in Zoom and on one of our ECHO sessions. On the left side, in the lower part of your screen, you'll have a microphone icon and a webcam icon. Those, if you left click, will respectively turn on and off your microphone and turn on and off your webcam. In the middle, there's a little chat bubble. You can use that to pull up a little chat window, which you can use to either type in things like your clarifying questions, your recommendations, or if you want to link a resource maybe that'll add to our conversation. We'll also ask it from time to time during our sessions for you to put in your attendance, which would be like your name, your organization, or email. You can use that. And if you want to just send a message to somebody specifically, you can also use that chat bubble to do that as well. And then on the lower right, there's a leave meeting button, which if you have to leave for any reason, you can just click that and that will exit you from the meeting. You can rejoin if you need to though after. So don't worry if you need to leave for some reason, you want to turn your camera, your complete session off. If you need to get up and do something, we understand it's during lunchtime. So feel free to turn your camera and your microphone off if you have to do something, and then come back and try to turn your camera back on as well. The upper right of your Zoom window has a little button that should either say gallery view or speaker view. That will actually toggle your view to either see the person speaking highlighted in a big box and then everybody else up top in smaller boxes. Or if you put it into gallery view, that'll kind of place everybody in that little window that we call either like the Hollywood Square view or the Brady Bunch view. And that's great for having kind of a conversation where we're doing the case discussion, because you really get to see everybody in the same size, just like we're just, kind of like you're in the same room as them. A few requirements for joining the ECHO sessions and using Zoom. Of course, an internet connection is required. A wired connection is always preferred, only because sometimes within these big hospitals, these buildings that we have, there is a lot of interference with wireless, and you may be getting an intermittent signal with your wireless connection. A microphone, a webcam, and a quiet space. And some best practices, like we just said, a wired internet. Wired internet is definitely the best way to go. In a nice, well-lit room, it looks like everybody that I can see on camera looks great. If you have the lighting kind of behind you, it tends to drown out your face and shadow you, so you look like you're in the witness protection, we like to say. Make sure your camera has a nice picture view of you, and that you're not cutting your face off, and that we can only see part of you. But it looks like everybody on camera is great. If you're in a conference room, having it nice so it displays everybody. There is like a few people that have a conference room where we can't see a couple of the participants, which if you can situate yourself in a way that we can see everybody, that's great. Stay muted when you're not speaking. That helps limit some of the feedback that we can get during the session if we have everybody unmuted and people are shuffling papers or somebody pops in and says something. And being on camera is always the best, because it's really about creating a community and creating a space that we all feel like we're equal and that we can see each other and we're having just a chill conversation with everybody. And then again, if you don't have a laptop, you can always use the Zoom app, and you can also dial in from your phone, which we have a few people on the phone today. There is a dial-in number included in the meeting invite, and also in the email that I send out to you on the day of the session. If you dial that number on your phone, it'll ask you to enter the meeting ID, and then you just put the meeting ID in, and you can enter it that way as well if you're on the road, but you just want to listen in. We do caution you, if you're driving, we don't want you to be doing anything unsafe. Maine is now a hands-free state, so just make sure you're only listening in and you are paying attention to the road. And you can use *6 to mute and unmute yourself as well if you are on your phone. So I will go ahead and turn it over to my co-host, Penny, to go over some objectives. And she should unmute probably using the lower left icon on her Zoom window.
Oh, let's unmute her.
Or I can unmute you, Penny. I got you.
I'm trying to find my way back to the right screen. There you are. It's too many things open. Okay, I'm back. So I was remiss in not introducing Jonathan and Lise to you, who are really the brains behind all of this. So thank you to both of you for doing what you do. And I am already breaking one of the technical requirements because I don't have a quiet space. Here at Healthy Acadia, we have grown so much recently that we've outgrown both of our office spaces in Ellsworth and Machias. So we are expanding. So I'm reporting to you live from the Healthy Acadia kitchen here in Ellsworth, which is the space that I was able to get. So hopefully there won't be too much distraction behind me, and I will stay muted for most of our time together. So what we're going to do today is meet each other, which we've done, and across the life of the Echo into the spring. You know, one of the goals is to connect you all to each other, to establish a broader community of support and expertise in MAT. For those of you who are doing the MAT work and prescribing and behavioral health components across Washington and Hancock counties. We hope to help you increase confidence and satisfaction in doing the work for prescribers and others, to explore the importance of screening for mental health concerns with opioid use disorders, to define why behavioral health conditions are important to identify and address, increase competencies, implement MAT and supportive models of care for OUD, bolster skills to appropriately identify and treat OUDs. I'm sorry, I'm just reading this to you, but to build individual and organizational resilience to support complex patient care and sustain MAT. So those are the things that we hope you'll get out of signing on for this program, in addition to the valuable networking, support, and professional networks that we believe will be strengthened. Next slide. So this is the schedule of sessions after this one. Jonathan, I think, is going to get into the anatomy of an echo session in a little bit, but I'll spill the beans a little bit. So every time we get together, there will be a brief didactic portion in which one of the faculty members presents 10 or 15 minutes on a particular topic, and then we switch to the case study. So these topics that are listed here: understanding addiction, stigma, MAT basics, tip 63, pain management, special populations, UDS, and building capacity for behavioral health counseling. Those are the topics for the short didactic sort of teacher part of each echo, but the bulk of each session will be spent doing a particular case study. So that's for you to look ahead and know what's coming up. Next slide. And here's our faculty. And Jonathan, I think, has made a matching game. Do we get to play this, or can we match names and faces? We get to play?
We don't have a lot of participants on, unfortunately,
Right.
but the ones that we do, we wanted to make this fun for you. And I don't know your familiarity with the faculty that we've had. In past, We've had a lot of these people, which is great that they are showing up more and more in all of our echoes. So yeah, if you want to go, the idea was that we would just go like kind of box by box and see if they know who is that faculty member.
Yeah, and I'll just add that not all of our faculty are on the session today, and a number of them have done quite a few echoes, so they didn't need to sort of be here for the orientation. So we gave them the option of signing in, and some of them have, which is terrific. But so Jonathan, how do we play? Do we ask people to identify which letter is Clem DeVoe? Yeah,
and this is a participation kind of exercise, because echo is really about active participation. So everybody,
prizes? Talking about prizes?
Go, guys.
Is that in the budget? That's the question, Penny.
For sure. Tiny.
Yeah.
All right, any guesses which letter, or maybe some of you know?
So
guess that.
I think
All faculty can't.
have an unfair advantage, perhaps.
Yeah, I think that's cheating.
So I think you're right.
Very good. And Clem, I believe, Clem is on the call. Clem, would you say hello?
Sure. It's kind of chuckling a little at the process. Thanks for making it enjoyable. I'm Clem DeVoe with AMHC, and very much looking forward to and wanted to meet everyone today. So very much looking forward to our time coming up together.
Thanks, Clem. So who knows which one is Stephanie Nichols?
Participants mainly. Try to just jump in.
Oh, I know.
And,
Is any of our participants on the line?
Anybody worked with her before?
G.
Is it G? It is G. I think a lot of us probably know Stephanie from various programs. She's not on the call today, though.
She's not. What about Abby Frucci?
C.
I think yes.
C.
And Abby was actually on our first part of this program as well with our MHC Readiness Academy.
Yeah, and I'm gonna do something a little bit out of order on the slides too, and just say who these folks are as we're identifying them, even though that's the next slide. So Clem is a clinical social worker at AMHC, and I think director of programming. Clem, is that your official title?
Yeah, that's close enough. That's good. Yep.
Great. And Stephanie Nichols will be presenting the didactic on well, she's a pharmacist, and she'll be talking about I forget which topic is hers, but
Pharmacy stuff.
Pharmacy stuff. Right, that's a technical term. And Abby Frucci works for the Community Caring Collaborative. She's you can see, she's a licensed alcohol and drug counselor and has a lot of clinical experience. She's here in the ECHO to represent the recovery community, as she has a person in long-term recovery. So she'll be, I think, probably switching hats pretty regularly. So Deal Snyder.
Hmm.
Anybody know who Teal is? Clem, do you know who Teal?
Hey.
Yes, of course. I think most. Does anybody want? There we are.
Oh, there's Teal.
And so Deal is he's a psychiatrist at MDI Hospital and is medical director at the Downeast Treatment Center. Yeah, and he'll be doing the first didactic, understanding addiction as a chronic illness. What about Eric?
Who knows?
Hmm.
Everybody knows.
Know? Everybody knows?
Maybe.
See?
What was that? Yeah. Ann and team over there? I couldn't hear you.
E?
E.
Very good.
Good try, Doctor.
A again.
A again. And Eric is on the call, so.
Yeah, Eric, why don't you say hello again, even though we already kind of met you earlier.
Yes, hi. My apologies for not being on camera. This morning, I had a family member who had an accident, was life flighted to Brigham and Women's yesterday, so I've been to Boston and back in the last 18 hours to see them, and you don't want to see me on camera today. But as I mentioned earlier, my role is as a clinician, behavioral health counselor. I've been a substance abuse counselor for 33 years now, and primarily run a consulting business working on integrating substance use services into medical practices and general hospital settings, and really happy to be a part of this project.
Welcome. We're so happy you're here.
Thank you.
Elaine. It's getting harder now.
It is getting a little harder now. I feel bad. The team up there, I think you're the only ones that probably can see on cam, and Helen haven't heard yet.
Oh, yeah.
Hmm.
Do you have an answer?
H. I have H as a guess.
Oh, my bad. You say, okay, the order. We have to go down to the lower left and then across.
Oh, okay.
I did the order in left to right.
Oh, we have to do it in order. Oh, okay. Jennifer McConnell.
I just gave it away, so that was my own fault.
Yeah.
We're back over.
So she may be one that people aren't as familiar with, I think.
Yeah, she is, I printed this out in the smallest imaginable print. She's a physician with Miranda Cook Health and a substance use disorder treatment expert. Yeah, we look forward to hearing from her. And Julian, now it's getting kind of easy.
I think we know Julian. We know Julian.
We know Julian. Julian, can you say hello?
Hello, I'm a family physician, Mount Desert Island Hospital. Been involved with substance use disorder, part of the practice for the last dozen years.
Great. And Julian was part of the faculty for the Readiness Academy this summer also, and we're thrilled to have him here. And Elaine O'Connor would be H. So Elaine is a substance use disorder treatment expert focusing on perinatal, and she'll be doing the didactic on special populations, including pregnant women. So this is our esteemed group of faculty. We're thrilled. We have a lot of rock stars in this group. I'm really thrilled with how it came together and really excited to see to watch the group interact and learn together. So there's the list. Is this one me too? Yes, this one's me. So here's what we ask. There will be 8 monthly sessions. I'm counting this one. So it'll be the second Wednesday of every month from 11:30 to 1, starting in October and ending in May. That first half hour is usually the didactic, the introductions and tech stuff, and then the didactic portion, and then the last hour is typically the case study. So be here for as much of it as you can. We do record the didactic portion, so if people can't be there for that, we can provide that, but we definitely like everybody to be logged in. We love everybody to be here and also to present one case from your practice. So be thinking about that, and we'll talk more about that in a few minutes. 1.5 CME credits are available for each session. We love it when people actively participate, because that is the heart of the process, is people jumping in and sharing ideas. We get as much out of it as we put in, so please, we look forward to your robust participation. There are pre and post assessments that are really important. These evaluation pieces are important for our funders and also help us improve the program. So we take those really seriously. We do look through those to find ways to improve as we go forward. And that's another thing about more evaluation. So just log in with your evaluations and chime in so we know what's working. We can do a little more of it. That's the next slide. Are there any questions? Seems like not so much. Great. Jonathan, I'm going to hand it back over to you.
All right. So, and that was my idea. I apologize for the faculty thing. I was trying it out, so I thank you for humoring me through that process stuff. So we have Project Echo. Some of you are familiar with it. You were on our previous Echo. Some of you may have been on Echoes before, and some of you may not have really any idea of what really Project Echo is. So Project Echo is an educational model. It was developed by Dr. Sanjeev Arora and fellow researchers at the University of New Mexico School of Medicine in 2003. It stands for Extension of Community Healthcare Outcomes. It's really a nonprofit movement to improve care by gathering a community of practice together for learning and support, with the goal, an equal goal, of improving decision-making by collaborative problem solving. And when we say a community of practice, what we really mean is a group of people who share a concern or a passion for something that they do and learn, and basically want to improve how they do it, and basically, interact regularly. And it's really, like we've said kind of a few times, is it's about the interaction and it's about the community and building that throughout the program. So Project Echo is a movement to demonopolize knowledge and amplify the capacity to provide best practice care for underserved people all over the world. This is achieved by linking a group of specialists, content experts, which will be referred to as the faculty, to participants that wish to increase their capacity in a specific subject matter or discipline. These participants are traditionally referred to as either spokes. They may be referred to as the cohort or the learners. So you may hear a few of those terms being thrown out. So through a series of virtual learning sessions, the expert faculty members mentor and coach the participants via case-based learning and didactic education, as Penny had mentioned before. So regardless of what topic the Echo is covering, and regardless of the focus area, Project Echo really focuses on these 4 principles: the use of technology to leverage scarce resources, sharing of best practices to reduce disparities, case-based learning to master these complexities, and then using data, tracking the data to monitor the outcomes. So we have two visuals here, and these images just kind of give you a visual representation of how the echo model kind of works. So we have here the hub, which again refers to that multidisciplinary faculty. So through participation in the virtual community of practice, a learning loop is created, which kind of shows you on the left image. And it shows kind of this multi-directional flow of knowledge from the hub to the spoke, and the spoke to each spoke, and then also the spoke back to the hub. We like to say everyone has something to learn and contribute when you come into an echo session. And this really kind of highlights a key difference in echo versus traditional like webinars that a lot of people and a lot of us are used to joining, where it's truly an all teach, all learn method. So kind of in just summary, echo really is just a methodology, and it's using the Zoom software as its platform, its delivery platform. And kind of here it says, it's not a webinar, it's not a conference call or a stream session that you would observe asynchronously at any, kind of any time you want. It really uses the structured approach and format to share and democratize that knowledge through that case-based discussion and the hub to spoke to hub direct multi-directional flow of knowledge. So we will just kind of cover the anatomy of the echo session, the structured approach that we take for every session. It's always going to be the same. We'll open up with welcome and announcements. Then we'll launch into that brief didactic, which Penny said that's usually about the first 20 to 30 minutes of our hour and a half session. We'll stop for a brief roll call to get attendance. Then we'll dive right into the heart of the echo session, which is the case presentation. So our facilitator will ask audience members, first the facilitator will ask the case presenter to give a really brief 3 to 5 minute summary of their case. And then we will start off with clarifying questions. This kind of helps flesh out some of the details that maybe were not highlighted in the case. It's really important to hold off on wanting to jump in, and kind of what we all want to do is jump in and fix the problem. We want to dive right into the solution, but this is really for just those clarifying questions. We start with our participants first, and the faculty will hold off and wait until after all the participants have been able to ask their questions, and then the faculty have their turn to jump in, ask questions as well. And then the facilitator will move us on to our recommendations. And that's when we really dive in and we kind of look at, is there a differential diagnosis that we need to go through? Is there some deep prescribing? Is there med recommendations? And really, how do we solve kind of the main question, which we'll ask each of our case presenters to have when they do that case? That frames the conversation, frames the recommendations, and really hopefully helps you not only with that specific patient, but we want to amplify the outcomes to all patients as well. So I will have a note taker in each session who will be jotting down all the recommendations that come out, any resources that may have been brought up during the session. Those notes will be vetted by our faculty and then shared with the person that was presenting the case, as well as possibly the entire cohort as well. And then we'll just close the session with a few announcements, and we'll end. So I'm going to go ahead and stop sharing, actually share our case template, which I did send out. So hopefully some of you were able to look at that case template. So we've done our best to, and actually, is this you, Penny, or is this me?
It's you.
It's me.
It's you.
Oh, wow.
Mm-hmm.
I need to take a drink of water then. That's good. Okay. We're not sponsored by Poland Spring, by the way. So if you did see that, we can edit that out. So we've done our best to kind of put together a case template that really highlights the key parts of your case. If by any means, if somebody has a recommendation, something that you feel maybe should be added or taken away from the case template, this is a living document. We can change it. It's not set in stone. We've kind of pooled thoughts from faculty members and from past echoes to put together something that will give us the best case possible for you to, and also something that isn't going to be too lengthy to fill out. We don't want you spending hours of your day on this. We understand you all have busy schedules. We want you to spend maybe 15 minutes most. putting this together with your team. So I'll just run through it real quick here. You guys can all look at it on your own time as well. So like I said before, though, there's this part here, which is really important, is this primary question. Really try to put in there one or two things that you really want to focus the case around, and that, like I said, that'll kind of frame up the conversation a little bit and give direction to where you want this case to go as well. It may take another direction, and who knows, we may go off on a tangent that leads us down some other awesome roads. But again, this will kind of help reel us in and keep us on track to getting to what you really want solved in this case. So what information should be included in your case presentation? We really want these cases to be real-time, urgent, complex challenges that you're facing. They're not the type of cases where you had a patient 6 months ago that you went through a challenge with, you solved it, you have an outcome, and then now you want to report that to us. That's, not like an educational case. It's more of a, we have a patient here, we have a challenge, we're not really sure what to do, and we're all here as a community to solve it together. And then hopefully, again, that can now translate into helping not tens and hundreds and thousands of patients. So that kind of amplification of knowledge. Of course, de-identified information on the template. We do a vetting process on our own, but please just make sure, obviously we're here. We all want to protect the patient information. And we have a sign behind us here, the lovely PHI sign. So no HIPAA, no violations. So just it's critical to preserve patient confidentiality, of course. So the process for presenting the case. During each session, like I said before, the facilitator will call on the presenter to share their case. They'll verbally summarize the case. This should be about 3 to 5 minutes, kind of giving a high level overview of the case. The facilitator will then promote that discussion, going to the participants always first with clarifying questions, then the faculty, and then the same for the recommendations. And again, at the conclusion of the discussion, the note taker will provide that recap, and then the notes will be shared with the cohort. No PHI, once again. A couple of video conferencing etiquettes. This isn't just, I guess, for echo, but I like to think of it as just, it's hard sometimes to remember when you're on a conference call, you're not in the room with them, but you kind of want to create an experience as closely related to that as you possibly can. So, these I'm not going to go over in great depth, but, things like trying to include all participants in the room that are on the phone with you, making eye contact with everybody, which is hard sometimes because the eye contact in a conference call is really where your webcam is. That's going to look like you're kind of making eye contact with the group. Obviously avoid, talking over people. We do want to promote with an echo session free, open conversation. It's not really necessarily doesn't have to be calling on people. You can just unmute and share your thoughts and your questions and ideas. But of course, just being respectful to everyone, eliminating distractions. If you have some stuff going on in the background, shuffling papers, make sure you're muting yourself. Avoiding side conversations and, obviously shaming or harassing or making any kind of embarrassing comment to something somebody might say. And these are just a few other things, active listening, being aware that you are on camera. If you are on camera, that your mannerisms show. And if somebody sees you making a gesture or, like one of these, like, oh, then that doesn't create that warm environment that we want to. It's always thinking about how can we create an environment that is welcoming, inviting, and warm, and that will lead us to being a happy family and sending Christmas cards to each other, possibly. So at this point, I'm sure you must have questions.
Yes.
So one thing that you'll find in Echo is that Echo really tries to promote that nice long pause. It's super awkward. But so if you see that, that's giving everyone a chance to kind of formulate their thought, and some people have to unmute. So I wasn't doing that without reason. And now we'll go ahead and I think turn it over to Lise.
Thank you, everyone.
Introduce yourself, Lise, too. I don't know if we've...
Well, we didn't formally introduce ourselves. Not a problem. My name is Lise Tancreed, and I'm a consultant here at Qualidine. And my role is really to manage this project. And I've been with the company about 6 years now. And you've met Jonathan, but let him formally introduce his role. And then we have somebody off camera that I really would like to introduce.
Well, you know me. I've talked a lot of these. I've been with Qualidine, which was formerly Maine Quality Accounts, for over 3 years now, and I've had the honor of working with a lot of you already. And I've been involved in numerous Echo sessions, and definitely am passionate about Echo and what it kind of stands for. And I'm excited to help you all throughout the session. You'll hear a lot from me via email. It could be if you have a question, don't hesitate to shoot me an email or a phone call anytime.
Can you pan over to Kayla?
But pan with me.
Pan over. We'll see if you can see her without us
That's the
phasing out. Wrong way.
Wrong way.
Moved.
My left and
That's
right.
easier.
There she is.
Hi. Hi, I'm Kayla. I work at Qualidine as well, mostly on a lot of Echo projects, as well as our Caring for Me line. And as you can see, Jonathan's testing the full extent of our camera now.
And,
I can go back
and
away.
Kayla will be facilitating the ECHO programs. She did a great job facilitating our readiness sessions. And many of you joined those 3 sessions over the summer.
I'll try to keep everyone on track.
Well, I did want to thank and welcome back St. Croix and Eastport and Harrington, who all were a part of the Readiness Academy, and hopefully that benefited you in moving your work forward. And then we have Bucksport that will be joining us for the MAT extension session. So we're happy to have Angie and her team here, for the next 9 months. Our next session is going to be held on October 9th, and I think Penny did go over the time frame of those sessions. We are going to be looking for a case, as that is really the heart of the work that we do. The didactics are wonderful and they're a great learning opportunity, but the real meat of this work is around the case presentations. So I'd like you to be thinking about a case to present. I'm going to give folks 10 seconds. If anybody on the line would like to present a case for our October session, you can either chat that in or unmute your line, *6, and let us know if you'd be willing to present a case. And while you're making up your mind, Jonathan is really very helpful in putting those cases together for you. So don't be afraid of the template. We really need to have your ideas, and we can assist you in just completing that template. We will be reaching out to each of you offline, hopefully that you'll be brave enough to present a case. So having we're going to be giving you some time back. We went through this fairly quickly and appreciate your time and your attention. Any final questions that anyone has? And I'll turn this back over to you, Penny, to close us out.
That's great. Thank you to the whole ECHO team there, Lise and Jonathan and Caleb. They do a terrific job and really make this all possible. I've now migrated to the hallway in our Healthy Acadia Ellsworth office. I had to run away from the kitchen, and then I was next to a photocopier, so I think I found a quiet enough spot to take us out. Thanks so much for logging in today and joining us. We look forward to the sessions to come. If you know of providers who aren't here today who would benefit and you think may be interested, it is not too late to sign up. We would love to see even more robust participation from sites around the two-county area. Reach out to me anytime with questions. Reach out to the ECHO team there. They are amazing tech support and amazing support for putting cases together and answering all your questions. So let any one of us know if you need anything between now and then. And we will be knocking on doors to solicit cases. So be thinking about that.